My name is Karen Oler, and our son Jeremy has been a client of Cascadia for a number of years, and we have been involved with the team that is helping him, as well as the family support group. I adopted Jeremy as a single mom and got him from Brazil. And at that time, Dave and I were dating, and we ended up getting married a year after I got Jeremy, and then a year after that, we adopted our daughter, Amelia. Jeremy was always a very good little boy. He did well at school, had lots of friends, played on team sports, and did that through high school. For a senior prom, he was Mr. Congeniality. That's kind of his personality.
Jeremy became ill when he was a freshman in college with schizoaffective disorder and later addiction issues. It was there that we were kind of introduced to the world of mental health.
It came out of the blue. I mean, the idea that around November we thought something was off and things weren't going well, and just a few months later, it was totally off. And at that point, we didn't know what to do. We had to scurry around and find psychiatrists, counseling, and that was probably the most difficult period of our lives then.
It is a horrible brain disease and a significant health issue in this country. It has really negative stigma affiliated with it, and it's not about people who are lazy or just don't want to work, that they're consumed with so many symptoms or anxieties or trauma, and it's just really, really hard to get through the day without some support and encouragement.
What our work with Cascadia has given us is a reality check, a coping mechanism, and some constructive help on how we can live with this chronic condition that our son has, protect ourselves from falling into the same morass of despair and hopelessness.
It was a feeling of relief that there was somebody who actually cared about the situation, about us, about him. Because before, when we had to patch everything together, nobody had a holistic picture of our family, our concerns, his illness.
Having the opportunity to companion with clients in their journey and to kind of help them feel successful and satisfied with their lives, and to be able to do that in tandem with family members who also want the same thing for their loved one, feels like a real gift.
Cascadia has been actually evolving into more of a holistic healthcare organization. At first, when Jeremy started going there, it was more counseling, but it has expanded now to a full service organization. He can get his medical care, he can get his psychiatric care, he can get prescription, as well as housing. So it's a big umbrella that covers all the aspects of mental illness.
I can't imagine where we would be if we didn't have the support of a comprehensive mental health approach. We would have to be the care coordinators in a lot of disciplines that we don't have the skill to do. We've been blessed to have a team that has welcomed us to participate in it, and we are eternally grateful. They have been providing positive support and encouragement and trying to identify new paths for him to follow as he manages his life.
Mental illness affects every aspect of a person's life and their family. And supporting an organization like Cascadia can help those people and their families cope with it, thrive with it. It's very difficult, and there are times you lose hope. But they're always there, They've continued, they help keep us going.